This video is the demonstration of clinical palpation examination of the hip area for physiotherapy practice. We use the hypothesis approach as well, so that's why we come with some hypothesis in our mind. The clinical pattern hypothesis on the hip region, beside the major hip fracture, we have labrum tear, we have greater trochanteric bursitis, and we have osteoarthritic hip. And then another clinical diagnosis, I call it misalignment of the hip integrity problem as well. This means the hip joint is not in a perfect position, cause some discomfort or functional disability. To check with that, the patient will complain the hip problem is more in front or on the lateral side. Then the people with pelvic or lower back problem is more the posterior side. This is body chart differentiation. Then for the palpation to start with, I start with the hip ASIS jaw and imaginary line to the pupil symphysis. In this imaginary line, get the midpoint and get the palpation. This is literally the hip joint line. Hip joint line, if you palpate, press on it, is the inguinal ligament. If any hip integrity problem in this joint line, you may feel localized tenderness here compared with the other side. But it mainly tells you about the hip integrity problem. It doesn't tell you exact diagnosis. Another one to check about the hip integrity is the capsular pattern. Amongst the capsular pattern, hip flexion and hip internal rotation are quite sensitive enough to test out any symptom, pain provocation or symptoms in the hip integrity problem. If patient will have some discomfort in the hip, they will complain the inner hip, the groin area, some discomfort compared with the good side. And also, you may see decrease in internal rotation of the hip. You can see this angle compared with the good side. Then coming back, then usually if they have hip integrity problem, they sometimes have overcompensation of the adductor muscle. You can also do a deep palpation on the hip adductors as well, see any muscle soreness and overuse. Okay. For another hypothesis is the greater trochanteric bursitis. If for greater trochanteric bursitis, the people will report to you the discomfort on the lateral side of the hip. So for the lateral side of the hip on the palpation, first is according to the anatomical approach, find the greater trochanter, or use your hand to slide. The most bony prominent part is the greater trochanter. But the bursa is not on the greater trochanter, it's about one finger below, okay, one finger tip below this area. Then you can find the local discomfort here. If you cannot find it in supine lining, you can turn on the side lining, it's more obvious. If people have greater trochanteric bursitis, the presentation is the discomfort around the lateral hip, but all the function are intact, just like balance, walking, jogging are like normal, beside the localized tenderness here. It is the demonstration of the clinical assessment of the hip joint for physiotherapy practice.